Today, we're going to talk about some key aspect of your exams. That means expected finding and concerning finding. In the safety exams, you should be able to figure out what are expected finding. And as you learn, those are the things you focus on. You want to focus on things that will you be able to figure out which one is a problem or not. It's always a problem. How do I know this is something that I should worry about? Or how do I know this is the most important things we need to do? So this is what the video is about. I created some questions. Um, it's like prioritization. And this is what it look like. You see, you're not comparing any of the information. Take it as an isolated information. You're not comparing to anything. And that should be the way you should pay attention to when you study and say, oh, if I'm talking about appendicitis, what should I worry about? That is the key. And so I will go through them and then I will let you also try and see what it look like. So a nurse is assessing several clients, right? Like which of the following scenario presents concerning or expected finding? If you read each of them, ask yourself, is this what I expect to happen? Or this finding is inconsistent? This is what I call what? You have to be sharp. This is what be sharp is all about. If you read one statement and you find the buzzwords, I've used the buzzwords for the diagnosis. Those are the buzzwords for that problem. If you look at it and it doesn't concern you, then you should not pick it. But if it concerns you, then it's a problem. That is all. It's not that difficult. First one, a client at 36 weeks gestation. That is your buzzword, right? 36-week gestation. What is the problem? Blood pressure 160 over 110 and report about headache. When you hear this, there should be something buzzing in your ear. Does anything buzz in your ear and tell you that, oh, this is a problem? This is a problem, of course. 36 weeks, third trimester, with hypertension and headache, evidence of what? End organ damage. This patient is in trouble. So this is a problem. So first one is concerning, right? Second one, a client with nephrolithiasis, buzzword, with 7 out of 10 frank pain radiating to the groin and blood in the urine. Put down your answers if you know them. Do you think this patient deserve your 1 second if there is another 3 patient? Do you think this finding, a client with nephrolithiasis, 7 out of 10 frank pain radiating to the groin and blood in the urine, should concern you? If it concerns you, you should pick it. If it's not, then you said it's not concerning. What is nephrolithiasis? Kidney stone. How does kidney stone present? Frank pain radiating to the groin. What is going to happen? There will be blood in your urine. Is this expected? Of course. Is it concerning? No. A client with aortic stenosis has a systolic murmur head at the right upper sternal border. Go for the buzzword. Like I said, I've created the buzzword. I use the buzzword to create the question. And this is what you see in the Q bank everywhere. Your Nclex, the same thing. Anybody with aortic stenosis, are they going to have a systolic murmur at the right upper sternal border? If that's what you expect, then you pick it. If it's not, then you should worry about. Where does the aortic stenosis, or if you have aortic stenosis, where should you hear a murmur? Just because you see aortic stenosis should not bother you. The key question is patient has systolic murmur, head at the right upper sternal border. Yes, in the second intercostal space, when you put your stethoscope on the right upper sternal border, you're going to hear a systolic murmur associated with what? Aortic stenosis, unexpected finding. A client with nephrotic syndrome reports what? Swelling in the legs and has proteinuria of 3 plus on urine analysis, once again, you have to be sharp. Take care of the buzzwords. These are the buzzwords. What is the buzzwords? Nephrotic syndrome. What does they do? Swelling in the leg. What would you see? Nephrotic syndrome, there's leakage of protein. If there's leakage in the protein, it will go into your urine. You test your urine, they're going to have that. This is an expected finding. What should you worry about in nephrotic syndrome? Infection, headache. Those are key things you should worry about. That's expected. You see the thing when you study, these are the things, little things, if you know, you make Nclex really manageable. Everything they ask you, you have an idea what to, if I say something about nephrotic syndrome, you know what to expect. And therefore, when they change the question, you don't get trapped. A client with what? Diabetes insipidus. He has urine output of 4,000 ml in 24 hours. What do you expect in diabetes insipidus? If you need more content, it is adapting class. Click down, you go to my YouTube channel, a bunch of videos, a lot of videos. Some of them are free, some of them are restricted to membership. But what do you see? Diabetes insipidus, what do you expect? Of course, based on your content, their urine output is supposed to be high because they cannot absorb anything. They don't have ADH. Therefore, 4 liters in 24 hours is an expected finding. A client with schizophrenia, what is happening to the patient? Increased agitation, reporting auditory hallucination. Yes, of course, schizophrenia can be agitated, but when they hear something, auditory hallucination, you have to intervene. That is a priority. You got to figure out the content of their hallucination. Are they hearing things to kill somebody, kill themselves, or do something? So that's we have to worry about. Better that's it. So this is concerning. A client with the COPD has shortness of breath on exertion and saturation of 94 on 2 liters. Don't get trapped with this. It's a COPD patient. It's a shortness of breath. But when does that happen? Exertion. You saw shortness of breath is not enough during exertion. Its saturation is 94. You don't expect it to be 100 on 2 liters. The exertion happen when what? After the exertion, yes, shortness of breath. So this is an expected finding. If I tell you she is having shortness of breath at rest, yes. But when they walk, they get tired. So this guy, don't worry about it. A child with Croup has what? Backing cough and is using humidifier. What do you expect in the Croup? Backing cough. This cough is not the problem. It's getting something to make him comfortable. Don't worry about it. I know you get the strategy now. A client with glomerulonephritis, what do you expect in this patient? You have to be sharp. What do I need to see when I hear glomerulonephritis? Every time you're doing a question and you see glomerulonephritis, you tell yourself, I need to see this. If I see this, ignore it. T-colored urine, ignore it. Proteinuria, ignore it. The kidney is leaking. When it's leaking and it's inflamed, there will be blood in your urine, T-colored. Protein is going to leak, class 4. Don't worry about it. But what do you worry about? If the patient has hypertension, yes. So these are what I said. You have to be sharp, not expected. When you are being sharp, you see glomerulonephritis with hypertension, yeah, you pick it. But if you see proteinuria, you say, oh, T-colored urine is bleeding. Of course, I expect that. This is not a problem. Now, no. So that's your key point, right? So that's that one. Next one. A client with pancreatitis has a serum amylase of 1,000 and report epigastric pain. If you have pancreatitis, what is going to happen? Your pancreas get inflamed. What is going to happen to amylase? It's enzymes within the pancreas. It get leaked. into your blood. Your amylase will be 1,000. The pancreas is usually located in the mid-epigastric towards your back, rectoperitoneum. You're going to have pain right there. Therefore, this is fine. A client with asthma, what did they do? Wheezing with their inhaler, right? But what happened? Peak flow of 45% of their personal best. Ask yourself, bring your content. If you don't know, yeah, you have problem. That's why I said emphasis on content, mastering your content. There's no way they can frame the question. No matter what they do, you can figure out what they're asking you. Asthma patient is wheezing, right? Use the inhaler when you wheezing, and then did the peak flow. It's 45%. Do you think this is okay? Do you think this is okay? Peak flow of 45 is in the red zone. Badness, badness, badness. We got to see that patient. A client with aortic aneurysm. What is the problem? Blood pressure, 105 over 80. But what is the problem? Back pain. That's bad. That's a problem. You see? So these are the little things, if you have it at the back of your head, there's no way Nclex will trap you. In the case form, they will say, which of these findings is concerning? That's what I put in here. Aortic aneurysm with the back pain is bad, concerning. How about this? Client with colostomy reports severe abdominal pain and distension. If you have colostomy, should you have severe abdominal pain and abdominal distension? What do you think is happening to the patient? Is this okay? Ask yourself, is this okay? This is not okay. Patient is obstructing. It's worrisome. Okay, osteoarthritis. You use cane. Report 5 out of 10 knee pain when ambulating. You see the way I read it? I read the question so that it can be more comfortable. I can be more comfortable. I can understand the language on my own. I don't even read it the way it's written. I say, oh, osteoarthritis. I'm using cane. I have pain 5 out of 10 when I walk. Yeah, I have osteoarthritis. My knee is not good. If I walk, it's going to cause pain. There is no evidence of any problem except when I have pain when I walk. Therefore, I will be fine. A client on digoxin, his heart rate is 52 and report nausea. Guys, what do you think? Bring your content on digoxin. Ask yourself, when you have digoxin and your heart rate is 52, is it okay? And then you have nausea too. Is it okay? If it's okay, let go. But like I said, it's all based on content. Find the content and use it. Expected, known, or concerning finding. Is this a concerning finding for you? This indicating toxicity concerning. A client with co-optation of the aorta. What did I use? Report calf pain when walking. What do you think? If you have co-optation of the aorta, do you have calf pain when you walk? Is this a big problem? Then you should pick it. If it's not, then don't worry about it. But how do you answer this question? Go to the co-optation of the aorta. Like I said, I took the buzzword. What do I expect in this patient? What is the key content? The problem is if you draw them, their upper extremities blood pressure is so high, the lower pressure is low. So blood flow to their leg is low. If blood flow to your leg is low, well, when you walk, you're going to have calf pain, claudication. Don't worry about it. This is not ischemia. This is just concept related to co-optation of the aorta. I have a pediatric congenital heart disease cardiology. You should watch it on my website. It's on YouTube. It's free. This is an expected finding. It's not bad problem. A client with multiple sclerosis report difficulty walking and has muscle weakness in one leg. When it comes to neuro, There's a way you can figure out neuro questions and you won't be trapped. This is all Neuro 101. Multiple sclerosis patient, the only thing you should worry about is what? Airway, airway, airway. And that is what? Slur speech, dysarthria, right? Dysphagia, all those things. Anything they tell you about weakness, whatever, blurred vision, so far as it does not involve their respiratory system or swallowing problem, ignore it. A client with aortic stenosis, right? Saw it, yeah, systolic ejection murmur. But what is the problem? This patient now has chest pain and a systolic murmur. The chest pain can lead to sudden heart death, right? Sudden death because the aortic stenosis is the blockage in the aorta, right? Stenosis. As they exert themselves, when they start having chest pain, they tell you they have ischemia. Blood flow is now becoming limiting. And that one is a problem. But just having systolic murmur is not enough. But associated with chest pain is a problem. So this is what I want you to figure out as you read. And you can see these are concepts associated with this. A client with metformin report what? Muscle pain and dark urine. Have you seen or you read or watch a video? They talk about metformin and then they talk about muscle pain and dark urine. Something should be ringing in your ear. What do you guys think? What do you think about that? That you taking metformin and then you have muscle pain and you have dark urine. Is this what you should be seeing in this patient? And high five each other and said, yeah, well, that's the medication. Don't worry about it. This will go away. What do you see? This, what is the side effect, major side effect of metformin? Your board will ask you, guys, what is that? Major side effect of metformin that your board will ask you, lactic acidosis. If they don't give you lactic acidosis, they will give you this. This is related to your kidney. Lactic acidosis comes because your kidney is in trouble. When the kidney is in trouble, you get dark urine. When the kidney is in trouble, you get muscle pain from what? Potassium. This is a problem. So watch these kind of tricky questions. It's all checking how your content is related. You see, instead of if I put lactic acidosis here, everybody will pick it. But I did not put it there. Lactic acidosis comes because of a kidney problem. So you it's common with the Nclex. You take an exam, somebody tell you, I saw these questions, and so you think they're going to ask you the same thing. Yes, they may ask you, but they will change the wording. It's the same thing. They know, they know. I mean, they are very smart. They know that people know the questions, right? They will change the wording. Is the answer is there, but they use different language now. You see, muscle pain and dark urine say, well, there's no lactic acidosis. Therefore, I'm not picking that. Well, it's right there in front of you. This is concerning. And the last group of, so it's about 30 questions. What about the first one? A client taking amlodipine, report of flushing of the face and leg edema. Who is worried about this? If you have 1 second, will you see this patient? Are you really worried about this patient? What do you think? Think about it. I've shown you how I'm answering the question. So go to the buzzword, figure out the buzzword, pick the buzzword and see, oh, amlodipine. If I'm taking it, what does it do? How does it work? What major problem the board is going to ask me? Well, flushing sounds so bad in the face. And leg edema. What do you think? Is a calcium channel blocker. A calcium channel blocker is going to make your vein bigger. If your vein get bigger, there's blood there. It will pull in your face. You get flushing. You go to your leg, you get legomegaly, which is leg edema. So legomegaly is leg edema. There's no legomegaly, but I'm just using it to show you your leg is big. So you get edema. So this is expected. A client taking allopurinol report what skin redness after sun exposure. First, identify what is allopurinol and ask yourself, if you're taking this and you go outside, is your skin going to get red? Is this a problem? Is something you should worry about? What is the content related to that? Why do I ask that? There's a content related to allopurinol that you should apply to answer this question. So why did I use that? It's a sulfur drug. If it's a sulfur drug, what is the side effect of sulfur drug? Photosensitivity. What is the worst one? Stevens-Johnson syndrome. Therefore, Nclex is not going to ask you both. They will teach you, they will actually teaching question relating to photosensitivity. So you teach the patient to wear sunscreen, right? To wear long sleeves, wear a hat. Yes. But to concern you, you got to pick Stevie Johnson. This is not what they will say for Stevie Johnson. This is skin redness, photosensitivity expected. A client on Albuterol for asthma reports mild hand tremor after using the inhaler. You take Albuterol for asthma. After you use it, your hand is shaking, tremor. Do you call the doctor? Do you worry? Is he having seizures? What is the content? Albuterol is a beta agonist. What does beta agonists do? They speed things up. They make things go faster. If you take it, your hands will go faster. I'm just joking, but that's the easy way to explain it to you. It make things go faster. So you start having tremor from the beta agonist. It speed things up, sympathetic nervous system. Expected finding. A client on warfarin on consistent leafy green intake and then maintain an INR of 2.5, right? A bunch of words to confuse you. Warfarin, what is the buzzword here? Consistent amount of green leafy vegetables, right? And his INR is 2.5. Should you worry about it? Should you be concerned? Should you figure out why he's doing that? Do you have to teach this patient? What do you think? Put down your answer. Let me see. Do you think you need to intervene? Or just say, well, it's fine. You're doing the right thing. I think this patient is doing the right thing. Consistent amount of green leafy vegetables, and his INR is normal. Yeah, we should not worry about it. What about number 5? You're taking glargine. Now you're confused. You're sweaty, and you have tremor. What is that? What is going on with this patient? What do you think? What is going on with this patient? I created these simple questions, English questions are not supposed to be complicated. You're not supposed to have a lot of words. It's like 1, 2 words, right? You take the content and then boom, you put it there. Content, then you put it there. Same thing. Glargine, I give you the symptoms. Confusion, diaphoresis, tremor. What do you think? What is going on? What is going on with that? What is going on with five? With five, are you okay with 5? I call it you gotta be sharp. In the be sharp, we talk about breathing issue, electrolyte, shock, sepsis, hypoglycemia, hypothermia, airway, and pain. And you can see it's all over this case. All of them have one of them. These are signs of hypoglycemia. First, you have to recognize that this is insulin. If I give you insulin, the most common thing is hypoglycemia. Patients having signs and symptoms of hypoglycemia. This one, we worry about you. A client on Enoxaparin reports severe back pain and frank bruising. Tell me, should you be worried about this patient? Should you be worrying about this patient? Or you just said, okay, fine, clean, just follow up with this patient? I don't know. But first, you got to go with your content. If you're new, this is Adapt Nclex. Thank you for watching. This is the way I answer question. I go for the buzzword. Enoxaparin. Is he familiar with you? If it's not, break it down. Look at the surname. You know this is a medication. Look at it. It look like heparin. So this is heparin, right? Parin, heparin. Therefore, this is a form of heparin. I give you heparin derivative. You have back pain and frank bruising. What is happening to this patient? If you know, put down your answer. What do you think is happening to this patient? I give you heparin, you have severe frank pain and bruising, right? Bruising, frank bruising, right? This is the belly button, and they have frank bruising. What will cause your bruising on the frank area? This requires some content. Watch Adapt Nclex, you'll find it. But this is here. This is bleeding. Greater than a sign. That means this guy is bleeding from the heparin. That's why he has back pain and bruising. This is retroperitoneal hemorrhage. He's bleeding in his back and it's spreading to the frank. Therefore, bleeding is never good, right? Concerning. A client with a history of coronary disease is prescribed what? Sumatriptan for migraine relief. When they give you two medication or condition, see if there's any interaction or contraindication, right? Coronary disease, and you're taking sumatriptan for migraine. Should you take it? Is it acceptable or is fine? What do you think? Content is related. Should a coronary disease patient take sumatriptan? If not, why? Ask yourself, what is the content related here? Well, once again, there's a content here. Coronary disease, there is this problem. You have ischemia, right? The vessels are small or obstructed. They are constricted. It causes problem. Blood flow going to your heart is decreased, and therefore you get chest pain. Well, you should not take anything that causes vasoconstriction. Sumatriptan is a medication for migraine. How does it help with migraine? Causes vasoconstriction, and that's how it helps with migraine. Unfortunately, if it causes vasoconstriction to help with migraine, guess what? You'll start having heart attack if you have coronary disease. Therefore, it's no, no, no. The nurse need to intervene. This is concerning. This is worrisome. Bad teaching. All of them. You see how I did? I just changed the question. I can say intervene, concerning, right? Expected. What should you do, right? Question the medication, you see. So people sometimes get confused with the way Nclex. It's the same thing. I can use this, I can ask you 5 questions related to that. I would say question it, or is it concerning to you, or should you intervene? It's the same thing. So far as is a form of action. Yeah. Concerning. Post-Cholecystectomy. Yes, abdominal pain, right? Discomfort and shoulder pain. What do you think? Should you worry about it? Yes, cholecystectomy has abdominal pain and shoulder pain. This is gas pain. It's suspected. Don't worry about it. How about this? This one, everybody should put your answer down. 4-hour postpartum client. He just had a baby 4 hours ago. The uterus is firm, is contracted at the level of the umbilicus. Should you worry? Should you? It's 4 hours after surgery. It's firm, contracted at the level of the umbilicus. What is a bad uterus? A bad uterus is soft, so the one that is soft and boggy and big. This is firm and contracted. Hallelujah. We're good. That is good. We want the uterus to be midline, number one, contracted and firm. to prevent bleeding. It's doing the same thing. After you deliver, it's at the umbilicus. After 12 hours, it starts to go down 1 centimeter each day. And by the 7 days, it's in the pelvis. That is the content. If you need more, join our crash course or check my on demand. You get to know or check in my YouTube channel. We have a membership over there. So this one is expected. A client with hypothyroidism. What is hypothyroidism? What do you think? What symptoms should you see? Which of these symptoms, when you see, should worry you? Patient has bradycardia, is lethargic, cold intolerance. Do you expect this in the patient? If you expect, is it worrisome? Sometimes you can expect the symptoms, but it also can be worrisome, despite it's expected. Hypothyroidism, key, your symptoms would go down except your weight goes up. When you have severe hypothyroidism, you start getting bradycardia, really bad. You start having lethargy, really bad, and cold intolerance. This is what we call what? Mesothelioma coma. This lady, she's not doing well. This man is not doing well. This is mesothelioma coma. Buzzwords. These are all buzzwords. Hypothyroidism, yes, symptoms go down, but you are not never bradycardic until you're developing mesothelioma coma. You are never lethargic until you're developing mesothelioma coma, right? So, concerning. And this is our data class. 30 short questions, typical prioritization questions, typical content related question. I just take the keywords, I call them buzzwords, and tell you what you should worry about, what you should not worry about. He will put it in the case form. They will put it in throughout the case. I can do the same thing for infectious control. A bunch of things. I say which of these next actions are inappropriate. It's the same thing. Every topic you read, keep on asking yourself. You read respiratory, or you talk about emphysema. What should I worry about a patient with emphysema? And if you know it, that's what they're going to ask you. Thank you for joining us. If you want, we have a focus group coming up on Sunday. Is it like a 90 minutes where we talk about case study questions, high yield quick case studies. You can ask questions. You can join us. You can subscribe. Register here. But thank you for joining us. I hope you have a good day and keep charging as always. Take care of yourself and bye.